Hi, welcome to another knee moment from Knee Fit and 5 and MSM Products. I'm Dr. Matt Lawless.
And I'm Scott Johnson, physical therapist.
The first person today writes in, his name is John. He's a 68-year-old male, and he said he was scheduled for a total knee replacement because of his knee arthritis, and he was wondering if there's anything he can do to get his knee ready from a therapy standpoint for the surgery. Scott, what do you think?
Absolutely. John, I teach a preoperative education class where that's exactly what I do. I instruct patients on what to expect during their hospital stay and after their hospital stay, but one of the biggest pieces of this is giving them exercises to focus on to help them to get their knee to straighten and get their knee to bend, and then of course work on the strengthening exercises around their knee. There's a multitude of studies out there that indicate that the better your motion and the better your strength before the operation, the easier and the better your outcomes will be after the operation. So the main thing I focus on is try your very best to get your knee to straighten, try your very best to get your knee to bend, and then of course work on the strengthening exercises with the muscles around the knee. The interesting thing is that a lot of patients are concerned, they're a little bit reserved because they're afraid that they're going to do harm to their knee before the surgery. So I try to reinforce that they're not going to do any harm to their knee by doing these exercises before the operation. But just for more confirmation from you, Dr. Lawless, what are your thoughts on that?
Yeah, I agree exactly, Scott, with what you said. I think that it's very important to work on therapy exercises ahead of time. Patients do much better by doing the exercises, working on the motion and strength. And no, they won't do any harm to their knee. Their knee will do better with the exercises. So I highly encourage them. So, John, go out, do your home exercises, do your physical therapy, work on motion, work on strength, and good luck with your total knee.